Hi class, in this lecture we're going to talk about the Risk and Protective Factors Planning Model. Before we proceed with talking about the Risk and Protective Factors Planning Model, I want you to think back to the lecture on Precede Proceed. What were the three overarching processes that occur when you use the Precede Proceed model? Hopefully you said something along these lines: assessment, implementation, and then evaluation. So think back to the Precede Proceed model. The first four phases all have to do with assessment. The fifth phase is implementation, and then the last three phases all have to do with evaluation. So those are the three basic processes that occur in all of the different program planning models: assessment, implementation, and evaluation. It's just that the different planning models have these mapped out in different ways. So keep in mind that these are the basic processes. So we're going to take a look at another program planning model that uses the same three basic processes of assessment, implementation, and evaluation. Now this model is slightly different than the Precede Proceed because this model is typically used to develop programs that are targeted towards youth and adolescent risk behaviors. Now you may ask yourself, why do youth and adolescents need their own program planning model? Well, let's take a look at the 10 leading causes of death by age group in the U.S. I know it may be hard to see, but let's zoom in to take a closer look at the 5 leading causes of death by age group. Now, just looking at the 5 leading causes of death by age group, what do you see? You can clearly see that people under the age of 45 have significantly different leading causes of death than people 45 and older. People under the age of 45 are significantly more likely to die from unintentional injuries. And then, if we look at people under the age of 35, they're more likely to die of unintentional injuries, suicide, as well as homicide. Now, some people define adolescents up to the age of 26. So even if we were to look at the leading causes of death for people aged 24 and under, we see that they're still significantly different than people who are much older. Therefore, this particular group has risks that older people may not have. And therefore, it would be appropriate to have a planning model that could be used to develop programs to address this population. So let's look at some of the health risk behaviors for which this program planning model has been used in the past. It's included things such as violence, which would be appropriate because, as you saw, the leading causes of death for people under the age of 24 were violence related, including self-injury through suicide, as well as homicide. HIV/AIDS risk. And although HIV/AIDS was not one of the leading causes of death for youth, did you know that nearly a quarter of new HIV/AIDS diagnoses are among youth? So that's definitely a high priority for youth risk behaviors, as well as early sexual activity, adolescence pregnancy, tobacco, alcohol, and drug use. So what do you think are some underlying causes of those risk behaviors among youth and adolescents? Why is it that youth are more likely to die from unintentional injury, homicide, and suicide than older people? Let's take a look at this video. It's a TED Talk by Dana Perry and his talk on the big gang theory. We'll take a look and then get back to our discussion.
There to be supportive, to give him all that he needs to be able to bounce back and be a resilient, healthy child. The second reason I tell that story is because we have young people out there today, and especially young folks that may have decided to get involved with a gang. I shudder to think about who was not there for them. How did they get to that place? And so when we talk about the gang problem, I understand. Everybody knows that the gangs are a problem. Now, we may not know that it's a problem in our community, but we know somewhere there's a city dealing with gangs. I mean, let's just look at some of the headlines from August. Brooklyn teen survives 13 gunshots in a gang-related attack during broad daylight. 5 arrests in 2015 gang-related killing in Dale. Local gang members sentenced to 15 years for murder. 8 plead guilty in gang-related racketeering conspiracy case. Gang members target of a narcotics raid. Now, this was just in August. Right now, a National Gang Center has actually informed us that we have across the country over 27,000 gangs, comprising of about approximately 150,000 gang members. And out of that percentage, 35% of that total number are youth, are young people engaged in gangs. Young people. Now, you immediately may be thinking to yourself, oh, this is an urban problem. Out of that 850,000, 5% of them are in rural communities, in small towns. So the problem is really real. So for us, there is this notion that it's a big gang theory notion, that gangs are too large, they're too big, they're too dangerous, there's not much you can do other than suppress them or arrest our way out of it or just lock them up. A well-renowned researcher by the name of James Buddy Howe, he came up with several myths about these large gangs and these large systems. And he believes that this is indeed not the case. It is the actual opposite. We cannot arrest ourselves out of the gang problem. We have to actually do the complete opposite. And so when we talk about the enormity of the problem of gangs, we cannot let it preclude any of our efforts to try to solve it, no matter how big it seems. And so for me, when we think about a gang, and if I say the word and I ask for you to think about gang members, right now you couldn't help it. You thought about some of the acts and the despicable things and the criminal activities that our gang members are engaging in. From being drug deals, extortion, intimidation, gun violence, all of those things. But I'd like for you to ask why. How did they get to this place? So I'd like for you to peel back a layer. Let's just peel back a layer and ask why. And let's look at some of the risk factors for some of those young people. We have the same young people engaging in gang activity, they're dealing with some of these things, from violent communities to substance abuse issues, to dysfunctional families, lack of meaningful relationships, and a disconnection from their community. All of those things across the board. So for me, I want to talk a little bit about.
So as Mr. Perry mentioned in his presentation, there are a number of factors that ultimately lead to gang violence, and that included dysfunctional families, violent communities, substance abuse, or even community disconnection. The risk and protective factors model was developed based on a synthesis of research about factors that appeared to be correlated with the kinds of health risk behaviors that are listed above and on the previous slides. So it's important to remember, like Mr. Perry said in his talk, that you can't necessarily arrest your way out of these problems. The risk and protective factors model encourages researchers and practitioners to take a deeper look into the factors that may be associated with the targeted risk behaviors in youth and adolescents. As we talked about when we looked at ecological models, there are a number of different factors at the individual level can lead to harmful health behaviors, and that includes personality traits, behavioral skills, affective states, perceptions, or self-efficacy. And of course, we know that a number of factors at the microsystem level, and that includes previous violence victimization, the regular witnessing of violence, which can occur if a child lives in a violent community or if a child lives in a household in which violence is occurring between their parents or guardians. Also, the absence of a positive adult role model or even parent-child interaction can increase the child's risk for engaging in harmful health behaviors. And of course, we know at the mesosystem level. So unfortunately, children who live in lower socioeconomic status neighborhoods tend to have higher rates of violence in their communities. So the main assumption of the risk and protective factors planning model is that over the developmental process, youth experience some factors that may increase or decrease their likelihood of engaging in different problem behaviors that we discussed before. So let's look at these different risk factors at the different levels of the socio-ecological model. So as I mentioned, some risk factors at the individual level can include biological or psychological dispositions, but it can also include things such as attitudes, knowledge, and just problem behaviors in general. At the interpersonal level, their peers can play a significant role if norm in their community is to be in a gang, or the activities in which they have to engage are associated with violence. And as we talked about, family plays a significant role in how the family functions. If there's bonding or abuse within the family, that can lead to risk behaviors as well. And then with the school level factors can play a role. Is there a school climate that promotes safety, or is there a school climate in which violence is the norm? And then also looking at the norms and policies within communities and within society as large can also play a role in children engaging in risk behaviors. But fortunately, there are some protective factors that have been identified. At the individual level, those things include gender, intelligence, and temperament. Now ask yourself, how does gender play a role as a protective factor? Well, you got it. Overall, females are less likely to engage in risk behaviors. However, that doesn't say that all females do not engage in risk behaviors. And then also social bonding. So youth and adolescents who have an attachment to positive, pro-social individuals and groups tend to engage in fewer risk behaviors. And then also children, adolescents, and youth who have families, schools, and communities that have very high standards for behavior also tend to be less likely to engage in risk behaviors. Now, it's not to say that all youth who grow up in violent communities or abusive households are going to engage in risk behaviors. Some youth have resilience, and resilience just means that they are going to resist the urge to engage in risk behaviors even when they're exposed to them. So let's take a look at the phases of the risk and protective factors planning model. This planning model has 3 phases, which are broken down into the 3 main processes of all program planning models. That's phase 1, which is assessment, phase 2, which is implementation, and phase 3, which is focused on evaluation. So let's take a look at what happens in phase 1. So in phase 1, you take a collaborative approach, meaning that the researcher or the professional develops relationships with people in the target community. It can include youth and other stakeholders. During the assessment phase, you collect information that can be used to identify the key risk and protective factors that are relevant to the target risk behavior. Let's take a look at some different types of data sources. So data sources for information related to youth risk behaviors can include the Youth Risk Behavior Survey. So this is a national survey that's done by the CDC and provides data that's accessible to the public. So that can be a very useful source of information. But also, information on youth violence from the police in the target community can be helpful, as well as information from schools within the target community. And then, of course, because you're trying to make this very participatory process, you want to engage the target community in qualitative data collection methods such as town halls or focus groups. And you can actually see on this is an actual flyer about youth violence prevention focus groups that's being done in a community. So as I mentioned, you collect information about the risk and protective factors that are related to your target health behavior. After you've collected that information and developed an understanding of some of the factors that are associated with that target health behavior, you then go about selecting your theory, framework, or model that will best address your target health behaviors. So remember, you don't start with the theory in mind. You select your theory after you've conducted your assessment and determine what would best fit with the issues that you have identified. In phase 2, this is where you actually have decided on your intervention. It can be a theory-based intervention that you develop, or it can be an existing evidence and theory-based intervention. And then in phase 2, you implement your intervention. And as we know, the intervention may need to focus on multiple levels. It may need to focus on the individual level, but it also may need to focus on school level factors or other socio-ecological factors that are impacting the health behavior. But remember, it's important to focus on identifying an intervention that will be effective for your target population and then adapt that intervention for your target population. So, quick question. What were the 3 types of evaluation that occurred in Proceed? Hopefully you said process, outcome, and impact evaluation. And that's the same types of evaluation that will occur in phase 3 of the risk and protective factors planning model. However, there are a couple of slight differences in the outcome and impact evaluation between this planning model and the precede-proceed planning model. And we'll talk about that shortly. But during the process evaluation, this starts as soon as you begin the implementation, or even before you do the implementation of your intervention. The process evaluation is important because it helps you to make sure that you're on track, you're implementing the intervention as it should be done. And therefore, you're supposed to track and record program activity as the program is being implemented. In this program planning model, the next type of evaluation that is conducted is the outcome evaluation. Now, in this planning model, the outcome evaluation is looking at the more short-term or intermediate outcomes such as changes in attitudes, beliefs, policies, and opportunities. And the impact evaluation is looking at the longer-term outcomes. And usually the longer-term outcomes can be seen after an extended period of time after the program has been implemented, so perhaps 6 months, a year, in some cases even 5 years. But this is where you're looking at more long-term changes such as the change in incidence of risk behaviors. So let's take a quick look at an article in which the authors used the risk and protective factors model to understand peer harassment and school risk behaviors and develop an intervention. So by going through the 3 steps of the program planning process with the risk and protective factors program planning model, they were able to determine that they needed to implement a multi-level intervention because there were factors at the school level as well as the individual level that were associated with instances of bullying. For example, the students in the school needed to feel a sense of safety, and therefore that was a school level factor because they needed to change school policies in order to better have that type of environment. And then they also needed to make sure that students had appropriate support and skills in order to maintain healthy peer relationships and avoid bullying involvement. So, as always, if you have any questions about this model, don't hesitate to let